Foam dressings. Foam dressings, generally made from polyurethane with or without a film outer layer, are very absorbent and prevent strike-through or leakage of exudate. Foams are available with or without adhesive borders, as well as with standard adhesive or silicone as the adhesion material. The frequently used silicone backing facilitates painless and atraumatic removal. Foam dressings may be used in all wound types, and while indicated for wounds with moderate to large amounts of exudate, they are also suitable for wounds with little to no exudate, especially when used as a secondary dressing. The moist environment created under the foam dressing can facilitate autolytic debridement. Advantages of foam dressings: create and maintain a moist environment, are easy to apply, are effective under compression wraps, absorb light to heavy amounts of exudate, conform well to the wound bed and anatomical area, do not adhere to a moist wound surface, are available with antimicrobial agents, protect the skin against mechanical trauma. Disadvantages/considerations with foam dressings: require a secondary dressing if non-bordered, are not effective for dry eschar, may macerate peri-wound skin if the foam becomes saturated, are costly if daily dressing changes are required. Absorbent dressings. Calcium alginates. Calcium alginate dressings are absorbent, biodegradable fibers that are derived from browned seaweed and composed of calcium/sodium salts of alginic acid and manuronic and gyuronic acids. When applied to a wound with adequate exudate, the sodium ions in the exudate are exchanged for the calcium ions in the dressings, thereby forming a sodium alginate gel. This soft gel mass conforms intimately to the wound surface and creates a moist wound environment while continuing to absorb exudate until the dressing is saturated. Calcium alginates are indicated for moderate to highly exudating wounds of all types. Calcium is known to act as a clotting factor, factor IV, therefore, alginate dressings may be used as a hemostatic agent for minimally bleeding wounds. Hydrofiber dressings are soft, sterile dressings composed of sodium carboxymethylcellulose. They are able to absorb large amounts of wound exudate, which transforms the dressing into a soft gel, creating a moist wound healing environment and supporting autolytic debridement. Hydrofiber dressing are used on a wound with large amount of exudate. Hydrofibers tend to wick vertically, meaning the exudate will remain in the part of the dressing that covers the wound bed. A moisture barrier, as seen on the skin, will also help protect the peri-wound skin from maceration. Moistening the dressing before removal can prevent tissue damage as well as minimize pain with dressing changes. Hydrofibers are used in similar wounds as calcium alginates but are technically in a category by themselves due to their composition, features, and mechanism of action. They do tend to wick only vertically so that any excess dressing overlapping onto the peri-wound skin does not become wet with exudate. Advantages of calcium alginate and hydrofiber dressings: absorb large amounts of fluid, provide a moist environment once hydrated, facilitate autolytic debridement, conform to the wound bed, fill spaces, tracts, and undermined areas, provide protection from contamination. Available in multiple flat sizes and ribbons/ropes. Available with silver and honey for bioburden management. Disadvantages/considerations with calcium alginate and hydrofiber dressings: adhere to wound bed if exudate is inadequate to create gel effect. Are not suitable for dry eschar or low exudating wounds. Are not indicated for third-degree burns. Require daily changes for an infected wound if the dressing is non-antimicrobial. Require a secondary dressing. Collagen dressings. Collagen is the primary protein in human tissues and is necessary for wound healing and repair. Because of its chemotactic effects, collagen plays an important role in each of the wound healing phases. It attracts cells needed for healing, e.g., fibroblasts and keratinocytes, to the wound and then provides temporary scaffolding for these cells. Additionally, chronic wounds are known to have higher levels of matrix metalloproteases, MMPs, and a reduced number of the MMP inhibitor. When MMPs are present in a wound bed at too high a level, for too long a time, and in the wrong places, they begin to degrade proteins that are not their normal substrates. This can result in off-target destruction of proteins, E.G., growth factors, receptors, and ECM proteins that are essential for healing, and thus impair the healing process. Adding topical collagen to a wound provides an alternate collagen source that can be degraded by the high levels of MMPs as a sacrificial substrate, leaving the endogenous native collagen to continue normal wound healing and to protect other proteins such as growth factors. Collagen dressings may be 100% collagen or collagen combined with other materials such as calcium alginate or ORC. The collagen attracts cells needed for each phase of tissue repair and serves as temporary scaffolding for those cells to function. Most collagen dressings are intended to interact with the wound at the cellular level and are biodegradable, therefore, they have a minimal impact on fluid balance. Frequency of dressing change, which varies from 2 to 7 days, is dependent on the formulation of the collagen product and the amount of wound exudate. Collagen products are only placed on clean and/or granulating parts of the wound, not on slough or eschar. Most products are more effective if moistened with normal saline at the time of application, and are covered with a secondary dressing that will prevent desiccation of the material. Advantages of collagen dressings: bind MMPs, thereby potentially impacting wound healing, providing temporary scaffolding, and attracting cells to wound site. Create moist environment after interaction with wound fluid. Are easy to apply. Provide cost-effective advanced wound care. Disadvantages/considerations with collagen dressings: are not recommended for third-degree burns. Are not effective on necrotic tissue, require a clean wound bed. May not be appropriate for patients with sensitivity or cultural restrictions relative to the use of bovine or porcine products. Require a secondary dressing. Biologics. A biologic is a device or product that in its natural state is a contributor to the wound healing process and thereby manipulates the process when applied topically to an open wound. The materials used to produce biological dressings may be derived from human or animal tissue and may undergo extensive or minimal processing to manufacture the finished product. There are only 3 products used in chronic wound management that have received approval. 2 cellular products are Apligraf Organogenesis, Inc., Canton, Massachusetts, and Dermagraft, Shire Regenerative Medicine, Inc., San Diego, California, and a recombinant platelet-derived growth factor gel, Regranex, Bicaplermin, gel 0.01%. The cellular products are created from living cells and cultured in the laboratory to create sheets of cells cultivated on a mesh. They are not skin grafts, they do not take as does an autologous skin graft. The product does not persist in the wound bed, does not become vascularized, and does not promote ingrowth of the recipient cells into the device. Application of these cell therapy products onto a well-prepared wound bed creates an environment in which the cultivated cells deliver cytokines and growth factors that subsequently trigger a healing response from the recipient site. Apligraf is composed of bovine type 1 collagen with living fibroblasts and keratinocytes as well as structural proteins. It can be fenestrated to allow exudate to escape into a secondary dressing. Apligraf is applied to clean wound bed to create an environment where the living cells can deliver cytokines and growth factors that stimulate a healing response from the recipient tissue. Dermagraft is a dermal substitute that contains living fibroblasts, extracellular matrix, and a bioabsorbable polyglactin mesh scaffold. Dermagraft is approved for diabetic foot ulcers and is used in conjunction with offloading strategies and blood glucose control. Growth factors. Growth factors, GFs, are small proteins produced by multiple cells and act as signals to allow cells to communicate with one another. GFs specifically stimulate the migration and proliferation of cells, and thus the formation of new tissue. One specific growth factor that is available for topical application on a well-prepared wound is a recombinant platelet-derived growth factor, PDGF. Regrainex gel is formulated with 0.01% bicaplermin, a recombinant human platelet-derived growth factor, rhPDGF-BB, in aqueous sodium carboxymethylcellulose-based gel for topical administration. When applied to a well-prepared wound bed, Regrainex gel promotes the recruitment and proliferation of chemotactic cells, thereby stimulating the wound healing process and aiding formation of granulation tissue. Antimicrobial dressings.